Okay, we're live. Hi, everyone. Thanks for joining us today. My name is Krista Gervon. I'm with Princeton Integrative Health. I'm our communications director. And today I'm joined with Dr. Vin, as well as our acupuncturist, Joe Bonacci. We are talking about brain health, as June is Brain Health Awareness Month. And, as if you've followed us at all, or if you've been tuning in weekly, we have been talking about brain health for months. It's a big topic and a big issue that we are concerned about at Princeton Integrative Health. We have someone joining us now. We wanted to talk about brain health as it relates to PTSD and migraines this week, because it's also PTSD and Migraine and Headache Awareness Month too. So we thought we would combine them. It's a great opportunity to talk about those as they relate to brain health, because they both affect our brains. So let's get started. And again, thank you for joining us today. People think of PTSD as more of a mental health disorder, right, Dr. Vin?
Yeah, I would say so. I think that's how most people characterize it. There are certainly codes in the, psychiatric codes for it and that kind of thing. And that's where most people categorize it.
Right. So how does it affect the brain more on a scientific level than when we think of mental health?
So PTSD, even though it's classified with the mental health disorders, actually causes actual brain changes. That's felt to be due to the fact that many people with PTSD suffer a lot of stress that creates a lot of cortisol, and that chronic cortisol exposure leads to changes in the brain, changes in actual brain structure that can be quantified using things such as volumetric MRIs, where they can actually see the size of the different areas of the brain and quantify that.
Wow, it's so interesting. So since it is a brain problem and we are focused on brain health at Princeton Integrative Health, is there anything that can be done about it? And Joe, obviously, feel free to jump in and discuss with Dr. Vin.
There are specific areas of the brain. What they find is that the amygdala, the emotional center, is hyperactive, the one that's given off the fight or flight responses, so that's hyperactive. And then the hippocampus, which is involved with memory, and the prefrontal cortex, which is involved in kind of assessing what's going on. Though the activity in those areas is reduced, and they've actually seen reductions in the volume of those areas in people with PTSD. So what we have is an overactive amygdala sending out alert signals, and the hippocampus and prefrontal cortex being underactive, so not being able to tamp down those fight or flight responses. And so that's why people get that PTSD type of thing. So there are certainly things that can be done. Certainly some people therapy. There's been a lot of research into using psychedelic medications now, things like psilocybin, LSD. There's been research into helping to rewire the brain, if you will. And then there's other modalities that can be used to help with the nervous system, things like acupuncture, for example. So maybe we can get a view from an expert on that.
I wonder where we can find that. So Dr. Vinny did a good job explaining a lot of what I was about to explain in terms of the different parts of the brain that are affected by this. And essentially, like you said, the amygdala becomes hyperactive, the frontal cortex becomes hypoactive, and just so happens that studies show that acupuncture regulates both those areas of the brain. So essentially, there's points for acupuncture that help to reverse that process and bring it back into balance. And a lot of that has to do with, getting people out of a sympathetic nervous system state that's been turned on for too long and putting them in a parasympathetic nervous system state. But it addresses basically those two exact aspects that are out of balance just by treatment. And so essentially, like he's saying, we can also retrain the brain that way, the same way that we think about, learning how to throw a baseball and getting muscle memory. The brain has basically created a system and a training to have this one firing response, and the acupuncture helps to reset that. And treatment over time basically allows the person to train their brain to the more balanced state. And obviously things like talk therapy and supplements and other therapies really help along the way with that as well.
Yeah, I was going to say it's a great way to couple the therapy maybe that someone is going through with the psychiatrist or something like that to, you know, also add on the modalities of acupuncture and, like you said, supplements. It can all help help someone work through those traumas.
Yeah, actually, there's something called the NADA protocol, which generally is kind of related to addiction and curbing cravings. But it's actually used often for PTSD and these issues now. In fact, Department of Defense and Veteran Affairs now has it approved for acupuncturists to treat PTSD.
Wow.
So there's actually a new field developing where acupuncturists are being hired by the military directly and working within the military system and doing these treatments. And it's especially interesting because it's 5 needles in each ear that can activate that in a very simple way. And you can put people in a group setting. So, you know, you're doing group therapy with people, and then all of a sudden they can put these needles in their ear and let them hang out for 30, 45 minutes in a circle. And there's this kind of communal aspect to it from the talk therapy and also the acupuncture. They're basically able to get both benefits. But yeah, it's gotten to the point of efficacy and evidence-based medicine that, you know, those type of departments are taking it on.
That is really great to hear that the VA is doing that, just because we all know PTSD affects our military and service members, you know, more than anyone, honestly. So it's great that they're getting it mainstream, and hopefully it will continue in the health field beyond that. Did you guys have anything else to mention about PTSD? Otherwise, it can open up for questions, or we can move on to the next topic.
I didn't have anything to add right now. I guess, you know, obviously it's a huge problem for many of our military servicemen that are giving service to our country. So, yeah, we want to honor all of that. But, you know, not just for them, obviously. There are many different types of trauma. Some of them, you know, military is usually more traumatic injury, or, you know, certainly emotional harm when they see, you know, maybe a friend, you know, killed or wounded severely. But there are many, you know, it's huge in the society because people, victims of crime, sexual abuse, you know, all those people suffer from PTSD. And it might be many years later that they're processing it. So, yeah, I think we just have to be aware of it.
I'm seeing that in the clinic now, just people responding to the pandemic, honestly. And normal stress, you know, that what they're recognizing is like they normally had a stress trigger, and now that stress trigger is much higher. And they're like, I don't know why I'm reacting this way. You know, I used to just have this kind of response, and now I have a much heightened response. And, you know, a lot of it's just, you know, due to stress and, you know, the world as it is now. So I'm seeing it a bit more just in day-to-day life, as opposed to, you know, these more severe cases that we normally think about,
Right.
you know, just what's been going on.
Well, it's good that they're are acknowledging the trauma in a much shorter time than waiting years and years to really acknowledge that and go back to it and start therapy then. So hopefully starting that therapy sooner and starting acupuncture and other modalities like that sooner to begin the healing process can be helpful to a lot of people. And hopefully they'll listen here and maybe, you know, call in and schedule some time to work through that. We did have someone watching on Facebook. We have someone here today. So I just wanted to open up for questions about PTSD if you had any. Otherwise, we can talk a little bit more about migraines and headaches, but I wanted to pause for a second to give anyone the opportunity to ask a question. Okay. All right. No questions at this time. So again, June is Migraine and Headache Awareness Month, as well as PTSD Awareness Month, all connected with our brains. So let's move into migraines. Dr. Vin or Joe, feel free to answer. What causes people to have migraines? Because we know that most people don't get these intense headaches, but certain people do, and they come, you know, various times throughout the month, and it's just a horrible chronic issue that they're dealing with. So why?
So I'll take the first stab at it. You know, I think there could be many inputs for people with migraines. It could be, you know, some people it's food sensitivities. Mm-hmm. Some people, you know, women especially get hormonal headaches, so there's that hormone input. You know, certainly inflammation of any sort can play a role. What they're seeing in the brain is that it's probably a neurotransmitter imbalances with serotonin, dopamine, norepinephrine, where those things get out of whack. Glutamate, which is an excitatory amino acid, that all getting out of whack, and the brain not being able to kind of get those things in balance. There's been evidence that there's the mitochondria in people who have migraines, mitochondria are hypoactive, underactive, and so it doesn't have the energy to inhibit some of these things. So, that's some of the underlying science of it. And, again, Joe, did you have anything to add to that in terms of that, or?
No, I mean, that's pretty much everything I was going to say. The hormones, again, it's been characterized as a chronic sympathetic nervous system condition in some ways. Which also just leads to everything he was saying about the neurotransmission pathways and why they're out of whack in the first place. And definitely hormone levels. The onset of the cycle tends to be a very, intense time in terms of migraine development. The only thing I would add is, in terms of headaches and migraines, a lot of times the migraine has, more of this internal mechanism that we're talking about. But just the nature of having chronic migraines makes people have these body postures that kind of make them curve forward. It ends up with a lot of neck pain, and there's very obvious trigger point referral patterns that go up to the head in terms of myofascial tension, these tension headaches. And so often what I find is that they started out with the migraine and they're still getting these episodic migraines or migraines at the end of the month for their cycle. But also in between, they now have a headache. So they're like, I get the migraine, but I have this constant headache. And really what's happening is they're so debilitated by the migraine itself, their body posture is now creating myofascial trigger points. And so a lot of times the treatment, it can take a little bit of time to get the migraine cycle to regulate. But in the meantime, they're now getting rid of their daily headache because we can treat that much faster with the acupuncture in terms of myofascial release techniques. So they can get kind of this more daily relief, and then you're working more on this episodic process. And obviously they're episodes, so you can't tell if you're affecting it right away. You're waiting to see if this time of the month comes around. But yeah, generally with treatment, those things can go down in severity and frequency pretty quickly.
And what causes those symptoms when you have a migraine? The sensitivity to light, sensitivity to sound, all of those. What happens?
Yeah, so because the neurotransmitters some of them are overactive. What would seem like a normal stimulus to us is just magnified by that. Yeah. So, that sound that maybe is, maybe not even loud to us, it's like amplified. And somebody who has a migraine, it's just amplified in their brain. So that it just becomes debilitating.
Yeah. You're kind of in a state of paralysis for a moment until it passes. So.
Yeah. And same thing with light, photosensitivity, all of that. So all that same underlying mechanism with the neurotransmitters just magnifying all those
that makes
stimuli.
Yes. So what can be done about these headaches and migraines that people are experiencing? I know, Joe, you just said, you can do these trigger points, but sometimes you have to wait a month to see if it's actually reducing the symptoms related to her migraine. But if it's not associated with the cycle or something like that, what can be done?
I mean, a lot of what we do is, look to see if there's a root cause, that it's not related to the cycle, but still sometimes, for women, we'll almost always look at hormones, but you could also look at toxins, inflammatory markers, nutrients, food sensitivities, all of that can contribute. So you're looking for the root cause. And then, you might be adding supplements, fish oil, curcumin, other things to help decrease inflammation, help the brain work better, help maybe some supplements that help with the part of the nervous system that helps inhibit, be somewhat more sedating and inhibitory. But certainly, what Joe said with the acupuncture also calms down that the overactive sympathetic nervous system, so that can obviously be very, very helpful.
What would you say to the person who, has these chronic headaches or migraines, and they rely on, your typical over-the-counter ibuprofen, Tylenol, things like that, they're taking, pretty regularly.
Yeah, that gets to be a problem for a lot of people. There's what they call medication overuse headaches, where the body and the brain get used to having some ibuprofen on board or some Tylenol on board, and just the absent, if they like, oh, geez, I've been taking too much of that, and they try to stop it, then the brain has like a rebound headache. So you have to work with people, to get them to understand that's what's going on, and then gradually withdraw them from those medications, so they don't get that rebound. Yeah, so.
Interesting. As we know, functional medicine, those medications chronically are inflammatory for the gut, and not very good for your liver and kidneys over time. It's just not the right answer in terms of a solution in the long run.
Sort of a temporary solution, but if you have the problem chronically, it's never going to actually make it go away.
Yep.
Great. If there's anything else you'd like to add about either headaches or migraines, again, if anyone on the call, on the Facebook Live or here would like to ask any questions, Kayla, obviously, if you have any questions, please feel free. But yeah, I'm glad we're talking about these topics. June seems to be a big month about brain-related topics, so I'm glad we're covering kind of the full gamut of brain-related health awareness topics for the month of June. All right.
Yeah, again, migraines are a huge problem for people. Unfortunately, many people suffer from them. And, we just want people to know that there's help out there. Obviously, there are prescription drugs that can be used for people who have really severe migraines, to kind of tide them over until they can get to somebody who can help them identify the root causes of it. So.
Right, and I was going to say, if you are experiencing these types of migraines or headaches, or even the PTSD that we talked about earlier, you can always give us a call, schedule a complimentary discovery session. You'll talk to a practitioner for 30 minutes for free, discuss your symptoms and any challenges that you've been having, and they can kind of guide you from there about what the best course of action would be to take, and then you would go from there. So if you are interested in scheduling an appointment, it's the number to call is 609-512-1468, and you can also email any questions to info@princetonih.com. We're always available. There's always someone to talk to if you have any questions. So we're here. And we have these discussions once a week. There's always a different health topic. So join us here on Thursdays at 4:30 for usually a brain health discussion, something related to brain health with Dr. Vin. And then throughout the month, we always have different events related to any other health topics that might be topical or, one of the monthly awareness month health topics. So thanks again for joining us. Thank you, Dr. Vin. Thank you, Joe. You have, again, given us so much knowledge and information, and so appreciated. And I hope everyone had a great time.
Thanks, Kristen.
I guess I would be remiss if I did not mention that also medicinal cannabis can be helpful for both PTSD and migraine. So just an aside.
One of the most obvious. All right. Well, thank you everyone for joining us again. We'll see you here next week at 4:30, and have a great night.
All right. Okay, thank you, Krista. Thanks, Joe.
Yeah. Thank you, guys.
Thank you.